Hi there, my name is Jeremy Seiler, and as part of Team 8, our group decided to talk about, as a healthcare management topic, overcoming the cost crisis and the increasing cost of healthcare in our country today. Go to the next one. Perfect. So, first thing we got to do is address the bottom issue, what we're looking at. So, as you can see on this chart, the leading issue in healthcare management in our country today is definitely that continuous rise in healthcare costs that continues to burden our society's really ability to provide accessible healthcare to as many or to everyone as possible. And we continue to observe that trend over the past decades, and it's projecting to continue to increase unless we obviously make some changes. So for the next one, thank you. Some big factors as to why our cost of healthcare keeps continuously increasing over the years. Some of these major players are uh, the aging populations are obviously becoming a big issue, and the continuous development of new treatments and research continue to drive the prices up, and even third-party payers such as insurers and government aid such as Medicare and Medicaid. All these programs continue to increase payments. Insurance, for example, especially how as they reimburse procedures performed, the main focus, instead of focusing on outcomes achieved, is usually focused on just the completion of the procedure itself, which can cause a lot of issues. And however, behind the scenes of all these factors, there's one major player that is not acknowledged as much, and it's usually that's causing these sorts of increasing costs, and that is the actual cost measurement system itself. And so, if you can go to the next slide, how cost is traditionally measured, like I said in the last slide, a lot of times the focus of payments and costs is at the level of the specialty or service department. So your procedures, your patient encounters and whatnot. Also, as we're all well aware, legislators, politicians, politics in general can muddy the water and cause confusion and disagreements, which causes a lot of costs to drive up. And the confusion isn't just on the patient's perspective, it's also, providers are not exempt from this confusion either. And like I said earlier, rather than using patient outcomes achieved as a way to measure cost, it's typically associated with the department level. Um, and so with the confusion and everything, this usually leads to situations where providers will, instead of allocating their focus and cost towards the best treatment for patients, it's usually towards where they will receive reimbursement. And for the next slide. So bottom line, we got to reestablish, redefine the true value of healthcare. And the simplest definition, the true value is patient outcomes achieved per dollar expended. And to further expand on this, both outcomes and cost need to be measured at the level of the patient. This is critical in maintaining or preventing confusion across all the people that are involved in a single patient's treatment plan. Um, and it must encompass at the patient level throughout the entirety of the patient's care cycle, from the moment they walk in for their first visit to their final follow-up per se. Um, and since many people are involved in the treatment process, the best way to keep track of where the costs arise from is through the patient itself, him or herself. And so I'll go ahead and hand it off to Jason.
All right, so let me move this real fast. So I'm going to touch upon the cost measurement process, which is basically how hospitals know how much to charge the patient. So starting with the first step in the process, it's selecting the medical condition. So what this means is you're either looking at the specific condition or even a patient population and any of the associated complications and comorbidities. And then you're also going to define the care cycle period of time, for example, 1 year. Next, you're going to define the care delivery value chain. And what this means is it's a big picture aspect looking at the activities involved in the full care cycle. And this includes monitoring and preventing stuff, diagnosing, preparing, intervening, recovering, rehabbing, and also managing. Third, you're going to develop process maps of each activity in patient care delivery. What this means is more detailed, more of the micro aspect of it instead of big picture. It's very detailed. And you're going to look at resources such as personnel involved, facilities, equipment. And after that, you're going to obtain time estimates for each process. And what this means is how much time does each provider or other resource spend with a patient at each single step. Next, you're going to estimate the cost of supplying patient care resources. And this is where you go into the real nitty gritty of everything involved. For example, you're going to look at employee compensation, or you're going to look at depreciation or leasing of equipment, supplies, operating expenses. And another thing you're going to look at is time spent. So for example, physician time spent, also teaching or doing research. You have to take that into account when you're calculating the pay for their clinical work. And finally, for this one, you're also going to look at employee supervision, space and furnishings, such as the hospital, and also support departments in the hospital as well. What comes after this is estimate the capacity of each resource and calculate the capacity cost rate. And to do this, there are 3 steps. The first one is you're going to look at total number of days each employee works each year. The second one is total number of hours per day they work. And third, you're going to look at average number of hours per workday for non-patient related work, such as taking breaks, getting trained, education, or having administrative meetings. And finally, at the very bottom, you're going to have calculate the total cost of patient care. And basically what this means is you're just going to add all the steps that I mentioned before and get a finite number to charge your patient. And for this next slide is just basically the second step I mentioned, the care delivery value chain. And you can just see these are certain steps for the big picture aspect of it. And this is an example for, excuse me, osteoarthritis and knee replacements. And next, I'm going to hand it off to Tanner for the next part. Or was it Monty?
No, it's me.
For Monty, my bad.
So what Jason explained was like the time-derived activity-based costing. So doing this, we're allowed to see the cost for the whole care cycle instead of individual cycles. And looking at the whole cycle, you can see areas of improvement and able to like find places to cut costs and therefore promoting value. So next slide. So during analyzing the whole cycle, you see physicians vary with the same diagnosis by using different equipment, different testing, and this creates a variation of cost even with the same diagnosis. But by analyzing the whole care cycle, you can see what variations actually cause improvements and what testing or equipment doesn't provide any benefit to the patient at all. So this allows us to eventually create a standard of care, able to say what tests should be used for specific diagnoses and prevent the unnecessary use of inefficient tests. So in the next slide. So even also by analyzing the whole care cycle, you can see how much each resource, like the space, equipment, and the personnel needed is used or just not used at all. Like for example, a testing machine that can test up to 10,000 samples, but in reality, it only gets tested up for 5,000 samples. So you can see it's not being used fully or to its up to its full potential. So by doing this, you can expand resources in high demand while cutting unused expensive resources. This also you can do is like you can determine which patients should go to services at properly resourced locations. So patients with simple diagnoses should not go to a complex or like level 1 trauma surgical center and impede costs. So you're able to determine which healthcare profession it should be matched for the exact diagnoses so they can free up time and free up costs and expenses. And next slide. So overall, when you're able to analyze the whole cycle, you have to create more optimization and reduce costs. And right now, currently, when someone is being treated, they're treated by different professions, different specialties. So they have faced with redundant steps like checking in, consultations, and workups, and these all take up time and money. So by reducing all of these and able to become more efficient, you can minimize readmission and additional costs. So I'm done. So Tanner.
So as was mentioned before, Without accurate information about how much it costs to actually treat a diagnosis, budgeting teams are faced with reducing spending by arbitrary amounts across departments. These budgeting meetings can be time consuming, be full of power negotiation tactics and heated arguments. The whole budgeting process is complicated by the fact that they're making budgeting decisions without knowing whether the cuts would actually improve value or possibly negatively impact patient outcome. And the reason the budget planners behave this way is in response to lower reimbursements from the government and insurance providers. But this behavior is a strategy of survival and not of efficiency. By using accurate costing methods, this enables providers to see how much they actually need to spend to treat a condition and cut costs in those areas through process improvement. Next slide. Instead of the reimbursement being based off of what has been paid in the past for that procedure, accurate costing can help connect the reimbursement without what it actually costs to provide the service. With a reimbursement plan that is tied more to the actual costs, payers can introduce reimbursement methods that reward value-oriented physicians. Through all these methods, it should help to reduce overall spending in healthcare while improving value for consumers. Thank you for listening to our presentation.